Protecting biosecurity is a critical part of the state government's efforts to prevent, respond to, and recover from the impact of pests and diseases on Western Australian agriculture, fisheries, forestry, and the environment. To learn more about this hazard, we spoke to the Department of Primary Industries and Regional Development, first looking at plant pests and diseases.
The most vulnerable regions in WA for pest and disease outbreaks are obviously the growing regions, the grain growing areas, the horticultural growing areas. Because of Western Australia's geographic isolation, there's limited potential for natural spread of pest and diseases into the state, because we've got an ocean on one side, a desert on the other side, so we're fairly well protected. Having said that, the north is an area, and not just in WA, but Australia-wide, the north is an area that's at high risk because of the proximity to our Southeast Asian neighbours, and there is that potential for natural spread of diseases. The factors that increase likelihood and consequences of pest and disease outbreak is definitely the global increase of people and goods moving around the world. There's a lot more imports into Australia, into Western Australia. There's a lot more traffic and tourism, and people and goods will bring exotics with them. So the consequence of pest and diseases can be quite significant on our industry. Western Australia has a $6 billion export industry in grains and horticulture per year. Some of those pest and diseases can be that significant that the export can come to a halt overnight, and that can take quite some time then to re-establish that market access. Okay, the main impacts of pest and diseases is really twofold. First of all, there's obviously an impact, there can be an impact on production and production costs. There can be quite significant yield losses because of a pest or a disease outbreak, but also one of the significant impacts is on market access. And for example, if in Australia we have an outbreak of carnal bunt, which is a disease of wheat, export can come to a standstill overnight, and it can take quite some time to re-establish that market access. So it potentially costs billions, depending on the severity of the pest. In Australia, we deal with around about 70 detections per year of exotics. Not all of those result in responses, but quite often, quite a few do. In Western Australia, over the years, we've had a number of outbreaks of exotics. For example, in 2016, we were dealing with a Queensland fruit fly outbreak. Fortunately, it was an outbreak, was fairly localized in suburban area. It didn't really impact on any growing regions. So because we detected it early, we were able to eradicate that one. It almost cost close to $1 million. However, we did get some assistance from industry, which is very important, and also the local government and community was on board with that response, and that worked excellently. We eradicated that within 3 months or so. In early 2017, we had a detection of tomato potato psyllid, which is a sap-sucking insect. It affects quite a range of horticultural crops. The department responded by having about 130 staff involved in that project. The cost to the industry because of loss of market access is about $2 million per week, and that's ongoing for months. The other states responded to this exotic outbreak by virtually closing the borders to our horticultural commodities. And we worked with the industry to develop protocols to regain that market access, but it took quite some time. The community and growers, industry themselves, play a very important role in early detection and prevention of exotic outbreaks. We spend a lot of time on raising community awareness on the various exotic pests and diseases. We've developed mobile phone apps that people can use to identify exotic pests, but also to report them to the department. Because of the likelihood of people moving into the country and interstate, there is a very high risk of people taking hitchhikers with them, and it's that awareness that they're introducing something that looks different or that they haven't seen before. It's very important they report it to the department. There is definitely a global increase in movement of people and commodities and goods around the world, and that brings with it its risks. So over the years the risk is increasing, also because of the awareness, the scrutiny we put on our biosecurity systems. We have to demonstrate to our trading partners that we are free of certain pests and diseases. So there's that heightened global increased risk on our biosecurity system, but also the awareness and having to justify our strict import conditions.
These same biosecurity risks extend to include animal diseases.
So, in general, the most vulnerable regions for an animal disease will have high animal population and density. They will have a way for the disease to get in, so typically a port or airport, but also potentially migratory animals. And they will have an environment that's conducive to that disease establishing and spreading. So for those reasons, there are two parts of WA that we consider at highest risk. One is the southwest agricultural region, where we have obviously a higher number of animals. They're in a smaller space, so we have a higher population density. We also have higher numbers of movements of people bringing in potentially animal products and things like that with them. And we have a nice temperate climate so that bugs can survive in the environment and they can spread between animal populations. The other area that we find has a higher risk is the very north of the state. Here we have the tropical climate. We have lots of nice midges and mosquitoes and things that can carry viruses. And we have a risk from potentially things coming in via the Torres Strait, so either animals or even the vectors themselves flying in. We also have a population of livestock that maybe aren't seen as often, so there's a risk that a disease could get into that population and spread. And for those reasons, we obviously have to target our surveillance programs to make sure that we would find any diseases in those areas. So the factors that increase the likelihood of a disease outbreak are very similar to those that increase the risk of disease happening in an area. So we need a way for the disease to come in, we need a susceptible population of animals, and we need an environment and some management practices in those animals that are going to help spread those diseases around. In general, animal movements into Australia are very well managed, so the risk from the legal live import of animals or even the legal import of animal products is very low. The highest risk to WA, so the things that increase the likelihood of disease coming in, are the illegal importation, particularly of meat and dairy products, and then the illegal feeding of those to a susceptible population, in particular pigs are a high risk there. As Australia and Western Australia are free of many of the significant diseases of livestock, our livestock don't have immunity to those diseases. They'd be very susceptible to the disease, and if it came in, it would spread very quickly. And in particular, as we see an increase in movement of people and product around the world, that risk is ever increasing. So the consequence of an animal disease outbreak in Western Australia really depends on how quickly that disease is found and how quickly it is controlled. So early detection is key. If we can find that disease early when it's only in a small number of our livestock, we can control it and eradicate it far more easily and far more economically than if it's in a large number of animals. Once a disease is found, taking actions such as stopping the movements of animals and other products that might spread the disease is the next most important thing in stopping it from spreading throughout the state and getting it under control. The biggest impact of an exotic or an emergency animal disease outbreak in Western Australia would be economic. Western Australia exports around 80% of its animals and animal product every year, and in 2015-16 that was worth $2 billion to the West Australian economy. Those export markets would potentially close overnight in the case of an animal disease outbreak. So a really good example of a disease that has a significant economic consequence is foot and mouth disease. It's a highly infectious disease of ruminants and pigs that we don't have here in Australia. If we were to get it, it would spread very quickly. It would impact our export markets immediately and for a long time, so for months or years. So the modelling that has been done on that disease has estimated that a multi-state outbreak of that disease, which is very feasible, would cost the Australian economy $52 billion over a 10-year period. Now, the majority of that loss is in export markets, but it's also obviously associated with controls of the disease and the knock-on impact on things like abattoirs and meat processors, stock agents, transporters, feed mills on the local economy. Some animal diseases also carry a risk to human health. So a good example of this one is avian influenza. So the 2003 outbreak of avian influenza in China has resulted so far in over 750 human cases, and half of those people have died. So there really is a very significant risk to human health there. And we could get these sorts of diseases in Western Australia. Additionally to these economic and human health impacts, any large-scale outbreak is likely to have important social impacts on the affected community as well. So particularly in a rural community that was affected by an animal disease, where we might have property quarantines, potentially even things like road closures, you're going to get knock-on impacts onto that local community and onto their economy as well. Disease outbreaks elsewhere in Australia may still impact Western Australia. So for example, if we got foot and mouth disease in another part of Australia, Western Australia's export markets would be equally impacted. So the risk profile of these emergency animal diseases certainly appears to be changing. We've got an increasing incidence of these outbreaks both nationally, so elsewhere in Australia, and also internationally, and that's fueled to some degree by, the movements of people and animals around the globe, but also environmental factors as well. In Western Australia, we undertake surveillance for these emergency and exotic animal diseases, and we regularly see things that look like them, and it's absolutely critical in those cases that we can get in and test for those diseases and make sure that we don't have them, and prove to our trading partners that we don't have them. So prevention is the key to protecting WA's livestock industries from diseases. We need the livestock industries, the associated industries, and the general community itself to be our eyes and ears. We need them to be out there looking at animals, and if they see anything unusual, if they have sick or dying animals, to report it either to their vet or to one of the department's vets, so we can get out there and, if there is a problem, find it and manage it as early as possible. Farmers can help protect themselves and their industries by managing their biosecurity on property. So having a biosecurity plan, making sure animals that they buy into their property don't bring diseases with them, and making sure that they report anything to either their vet or a department vet if they have any concerns.
If there are incursions of diseases or pests, measures exist to respond to these incidents.
The department has a responsibility under the national arrangements, under the Intergovernmental Agreement on Biosecurity, under the Plant and Animal Health Deeds, to undertake surveillance and capture data to prove that Australia is free of serious exotic pests and diseases. We have a responsibility to train staff and to have them ready to mount a response, to stand up a control centre and use the national emergency management responses, policies and procedures to carry out a major incident response. That also requires strong liaison skills and setting up structures to manage and deal with industry and government jurisdictional liaison, communication and decision making at the national level. So during a major national response, the department would be required to liaise with the Commonwealth, with all jurisdictions, with Plant or Animal Health Australia, with key national industry groups, local industry, state agencies, and all affected parties in a major national incident. So during a major state emergency, for example, foot and mouth disease, where we are required to liaise and work very closely with other state agencies, our Director General would set up a command centre involving all agencies, and key to some of the activities we would be taking, for example, with transport movements, impacts on local regions, is the need to liaise strongly with local government, to liaise with the fire and emergency services, with environmental agencies and the police, and make sure that we can manage the state movements required, make sure the quarantine impacts are not too severe on our local government partners, and those sorts of activities. So very much there would be a national command and control system and then a state command and control system, and it's our agency's role to ensure that all works smoothly and the best outcomes are achieved during a very serious situation. Once the emergency is under control, local government, local industry, local communities play a key role in the recovery phase, and it would be the agency's role to hand over to those local government and other local industries to recover from the situation and learn how to deal with the new normal after the emergency has passed.